So thanks, Aldo. It's Kari Jefford, President of Unifor Local 229's. Today we're here rallying with my membership from my local as well as other Unifor Locals and some other community groups to support our healthcare workers, our hospital workers in Northern Ontario, to actually see some fair wage increases at the table. We're coming off a 2 years of zero, where we saw some of our management and non-union staff see increases in the last 2 years. They saw 2 and 2, and they also were able to achieve wage grade increases by changing their classifications throughout all of the northern hospitals that we service as a local.
Now, what kind of groups are we talking about? Can you just give us a little quick example about like 4 or 5 of the groups we're talking about?
Yeah, so we're talking about nursing, we're talking about dietary, we're talking about housekeeping, paramedical, x-ray lab technicians. We're talking everybody that you would normally come across walking into a hospital.
Well, they all have an important job. We all know that, that's
Absolutely.
for sure. Terry, has the federal government been at the table?
So the federal government's refusing to come to the table. So our Canada Health Accord expired in March of 2014, and that was the agreement that the federal government had with all the provinces that was negotiated back in 2004 to see stabilized funding from the federal government to the province. They refused to renegotiate that. We're looking at huge decreases of about $36 billion coming by 2017. And of course, that all squeezes down through the province and into and out of our pockets as workers in our communities and to the services that they can provide.
How does this affect the average taxpayer? How will this affect me or my family?
So when you walk into a hospital and you're waiting 5 or 6 hours to see a doctor, or you don't have a family doctor, or you don't have a family practitioner, you can't access services. When you need cataract surgery and you're waiting 9 and 10 months for that to happen, or you need a knee replacement and you have to travel to Toronto to do that. All of those things are affected on a daily basis. We also see higher rates of C. difficile and different bacterial infections that are being picked up in hospitals just because there's such a decrease or privatization of housekeeping and cleaning services. You used to be able to have a home cooked meal that was cooked in the hospital that you were staying in. A lot of those services have been outsourced. We have management that are they're contract management in the hospitals that we service. They're contracted through the employer, but they're managing our membership, which is it's a race to the bottom, and we're seeing the effects of that province-wide, even more so in the north. When we can't have access to preventative services like diabetes and blood pressure, all of that kind of stuff. Those services are ending up in critical emergency type situations in the hospitals, and even then we're always in gridlock. The smaller hospitals don't have the equipment or the funding to be able to offer the services in the communities. It's very serious. It's very serious.
Obviously, it's going to affect a lot of people if we don't put more money in healthcare, and healthcare affects all of us.
All of us.
Terry, I just want to thank you for the time, and I want to thank you for all the work you do on behalf of the union, etc., and for our city. Keep advocating for the people.
All right. Thanks, Aldo.
Thank you very much. Have a good day.
One.